Next common fracture that occurs near the wrist and hand is Bennett's fracture dislocation. The fracture occurs and at the base it articulates with the trapezium. So take the thumb. Here there will be a fracture here or here. Along with that there is a dislocation of the joint, metacarpophalangeal joint of the thumb. Here there is not only a fracture as well as a dislocation. So if you look at it, there is a dislocation here, a fracture here, or sometimes this may be fractured. So this is a very important thing, because unless once again like scaphoid, if you don't realize this fracture, you are likely to end up in stiffness of the metacarpophalangeal joint and early osteoarthritis, that is secondary osteoarthritis of the metacarpal joint of the thumb. Normally itself in upper limbs, the commonest joint that is involved in osteoarthritis is metacarpal joint of thumb. Normally, just like in the case of very common things like osteoarthrosis of the hip, osteoarthrosis of the knee joint, which are very, very common, same thing can occur in the metacarpal joint of the thumb. And these people will have tenderness, pain, all those things at the later age group at 60 or so. If the Bennett's fracture is missed, these people are likely to have this metacarpal joint of thumb goes into osteoarthrosis. It is called a secondary osteoarthritis because primary thing is the fracture. That's why we call it a secondary osteoarthrosis. Now, how to make out this fracture and what are the signs and symptoms? Just like most of the fractures of the upper limb and dislocation of the upper limb, metacarpal joint dislocation or Bennett's fracture is common due to fall and outstretched hand in a particular position, or a direct injury sometimes can produce this metacarpal joint dislocation. Symptoms are history of fall and outstretched hand followed by pain, swelling, and at the base of the thumb you have swelling and then tenderness, and movements of the thumb are painful, especially extension, abduction, etc. are very, very painful. So the actual fracture occurs at the base of the thumb, and X-rays will reveal the particular type of fracture. Now the treatment of this fracture is, if the displacement is minimal or there is not much of a fracture, only a hairline fracture with little displacement, we can manage conservatively with plaster of Paris. Plaster of Paris cast. But sometimes the displacement will be so bad, you can see this is a fracture here and there is a bad displacement of the trapezium like this. And these circumstances, there is so much of displacement is there, it requires open reduction and fixation with K-wire. Bring them back together into position by open reduction or manipulation under C-arm vision. Bring them back into position and then fix with a screw, oblique screw like this and then like this. K-wire has to be kept there for about 3 to 4 weeks. Small 1.5 mm K-wires are used and they are fixed in position. One of the K-wires must go through the fracture site. If it is only plaster of Paris application, the duration is very important. You keep it for about 4 weeks. And similarly, just in case of scaphoid fracture, the thumb has to be immobilized so that there will not be movement at the base of the thumb. Plaster of Paris should start here in this interphalangeal joint and come down to the middle of the forearm. And that too, here also you must keep it in little more abduction. So this is very important for doing any position. If you keep it in more abduction, the fracture gets initiated better.